Good morning students, hope all are fine. Today we will see an important topic that comes under midwifery and obstetrical nursing. This will be benefited for all our batches A&M, B.Sc and GNM for the practical presentation. So we will see today mechanism of labor, that is a normal mechanism of labor. First we will see what is the definition of labor. Labor, it is a series of events that takes place in the genital tract in order to expel the viable product of conception from the womb to the external world. Next, what is meant by mechanism of labor? A series of events, that is a cardinal movements that takes place in the head in the process of adaptation during its journey through pelvis or birth canal is known as mechanism of labor. Before going to next topic, we will see what are the components that comes under mechanism of labor. In normal mechanism, first we will see first one is lie. What is lie? Lie, it is the relationship of long axis of the fetus to the long axis of the maternal spine. In normal mechanism, the lie is longitudinal. Second one is attitude. This is the relationship of one part of the fetus to another part of the fetus. So here you can see how the fetus is. The fetus is completely flexion. So the attitude is complete flexion. The next third one is presentation. The part of the fetus that comes and lie in the lower pole of the uterus. So here the presentation is cephalic. The head is comes and lie in the lower pole of the uterus. The presentation is cephalic. The next fourth one is presenting part. The part of the presentation comes and lie in the internal os of the cervix. So presenting part is vertex. In that you can see the parietal bone. The next one is denominator. That is the orbitary bony fixed part of the presenting part that will comes and lie in the various quadrant of the maternal pelvis, that is occiput in normal mechanism. Then next last 6 point, that is position. The part of the denominator that will comes and lie in the various quadrant of the maternal pelvis, that is maternal pelvis consists of 8 quadrants. So here in normal mechanism we will discuss LOA, left occipito anterior. So you understood about component. Lie is longitudinal. The next attitude is complete flexion, presentation is cephalic, presenting part is parietal bone, then next one is denominator is occiput, then next position is left occipito anterior. Next we will see about what are the principles comes under mechanism of labor. There are 3 important principles that comes under mechanism of labor. First one is descent. Descent takes place throughout the labor. Second principle, whichever parts which comes and meet the pelvic resistance will rotate anteriorly and comes under the symphysis pubis. Then third principle, whatever part which emerges under the pelvis will pivot around the pubic bone. These are the 3 principles which comes under the mechanism of labor. Then next we will see what are the cardinal movements that present in mechanism of labor. Before going to the cardinal movements, first component is engagement. Engagement here, if you see the engagement in LOA, the engaging diameter of the fetal head is biparietal diameter, that is transverse diameter 9.5 cm, and the anterior posterior diameter of the fetal head is suboccipito-brecmatic, that also 9.5 cm. This is the engaging diameter of the fetal head. The fetal head will comes and lie in the transverse diameter or oblique diameter. So here we will see the oblique diameter. Oblique diameter mainly in the right occipito, right oblique diameter. In the right oblique diameter, the occiput will touches the left iliopectial eminence and sinciput will touches the right sacroiliac joint. So this is the right oblique diameter. The engaging diameter of the pelvic brim is right oblique diameter. So this is the engaging diameter. So once again I will tell, the engaging diameter of the fetal head is that is the anterior posterior diameter is suboccipito-brecmatic, that is 9.5 cm, and the transverse diameter is biparietal diameter 9.5 cm. This will comes and lie in the right oblique diameter of the maternal pelvic brim. So here the occiput will touches the left iliopectial eminence and sinciput will touches the right sacroiliac joint. The left oblique that is the diameter is 12 cm. So after the engagement, first cardinal movement is descent. According to the descent it is a continuous process. This takes place throughout the labor until the expulsion of the fetus. So descent. So the descent is facilitated by good uterine contraction. then next bearing down effort of the women, then next straightening of the fetal ovule after the rupture of membrane. So you can see according to the first principle, the descent takes place throughout the labor. The next cardinal movement is flexion. Along with the descent, flexion takes place. Flexion will give a complete space accommodating of the fetus in order to travel through the birth canal. So flexion also facilitated by unfolding cervix, then walls of the pelvic floor and the pelvic resistance. After the flexion, the third cardinal movement is internal rotation of the head. According to the second principle, whichever parts which comes and meet the pelvic resistance will rotate anteriorly and comes under the symphysis pubis. So here you can see the occiput. The occiput, it is the leading part which will comes and meet the pelvic resistance first, and it will rotate anteriorly and comes under the symphysis pubis. So here you can see now the suboccipitobregmatic diameter comes and lies in the anterior posterior diameter of the maternal outlet, that is the 13 centimeter. So this is the internal rotation of the head. During the internal rotation of the head, a slight twist is formed in the neck, that is known as the torsion, that happens during the internal rotation of the head. This internal rotation of the head is facilitated by well flexed head, uterine contraction, then wall of the pelvic resistance, and next if you see tone of the levator and a muscle. So these are the factors which will facilitate the internal rotation of the head. After the internal rotation of the head will comes and lie in the pelvic outlet. The next cardinal movement is crowning. So you can see the head. The maximum diameter of the fetal head, that is the biparatal diameter 9.5 centimeter, stretches the vulval outlet, no longer further resection of head back into the vagina even after the full uterine contraction is over. That is known as the crowning. So the maximum biparatal diameter stretches the vulval outer. So this is the cardinal movement known as crowning. After the crowning, then what happens, that is next movement is delivery of the head. This delivery of the head is achieved by couple of force theory. So here the driving force is there that will pushes the head downward, and pelvic resistance force is there that will give a upward and forward force. The downward and upward force will be neutralized and the forward force will be remains, and this forward thrust helps to deliver the fetal head. So the delivery of the fetal head according to the third principle, descent always takes place. According to the third principle, whatever emerges from the pelvis will pivot around the pubic bone. Here the occiput will comes under the pelvis. So here the occiput will escape under the symphysis pubis. Sinciput, face and chin sweeps beneath the perineum, and head will be delivered by the movement of extension. The head is delivered by the movement of extension. So immediately head delivered, the head will be chin delivered, the chin will drop down and face the maternal anal opening. Okay, then next what happened, a slight movement of head will takes place, that is known as the restitution, that will occurs opposite to the maternal thigh. This restitution is occurred in order to relieve the twist that is formed during the internal rotation of the head. So next movement is internal rotation of the shoulder. So where the shoulder is lying? Now the shoulder is lying in the opposite oblique diameter, that is the left oblique diameter of the maternal pelvis. So according to the first principle, descent takes place throughout the labor. Second principle, whichever parts which comes and meet the pelvic resistance will rotate anteriorly and comes behind the symphysis pubis. Here anterior shoulder comes and meet the pelvic resistance first. The anterior shoulder rotates 1/8 of the circle and comes under the symphysis pubis. Now the shoulder, if you see, shoulder will lies in the pelvic outlet. So if you see, when the shoulder rotating, the head also will be rotating. That is known as external rotation of the head. So after the internal rotation of the shoulder, the head, shoulder and the body are in the same alignment. According to the third principles, whichever parts which comes under the pubic pelvis will pivot around the pubic bone. So here you can see the anterior shoulder escape under the symphysis pubis, posterior shoulder sweep beneath the perineum, and the whole trunk is delivered by the lateral flexion. So like this, the mechanism of labor takes place. So hope you have understood about the mechanism of labor. So we have seen today about what is definition of labor, what is meant by mechanism of labor, what are the what are the components that comes under the mechanism of labor. Then next we'll see about the 3 principles of mechanism of labor. Then what are the cardinal movements that comes under the mechanism of labor. Thank you.